I would like to seize this opportunity to comment on the UK government statement which was released yesterday. Nigeria's status has not changed. Nigeria is not among the red listed countries that need to mandatorily quarantine for 14 days in a supervised UK facility. The statement released by the UK government is consistent with the press statement released last week that Nigerians will continue to isolate upon arrival to the United Kingdom. This is similar to our requirement that travelers from the UK should isolate for 7 days when they arrive in Nigeria. The Presidential Steering Committee is in the process of reviewing these requirements. We have been in touch with the UK government. Just like they stated clearly in their communication, the current listing of countries with approved vaccination certification has just started in the UK. They are reviewing the country's programs in phases. If you go through the list of 50, you will find that no African country made the list. The UK government is yet to comprehensively review Nigeria's vaccination certification program. From my communication with UK government officials, these vaccines that are administered in Nigeria are approved. The UK government officials are also involved with the vaccination program in Nigeria through the Foreign Commonwealth Development Office, the FCDO. And they are optimistic that by the time Nigeria's COVID-19 vaccination program certification is assessed, it will be approved. There are many countries in the world, so we, like many other countries, are in the queue for this assessment. Once it gets to our turn, we are more likely than not to get approved in the coming weeks. Like the UK government has stated very clearly, the process of approvals will happen in phases, country by country, based on an assessment that is yet to be conducted in Nigeria.
It is indeed a time for us all to support Nigerians to get vaccinated. I also wish to sincerely appreciate the government of Nigeria's efforts and congratulating them for their effort in preventing, detecting, and responding to COVID-19. We must therefore continue to use the available tools that we have to continue to protect ourselves against COVID-19. The vaccination is part of the tool. But today, with the proportion of targeted population reach, vaccine alone will not be enough. We must continue to observe other measures that we've been observing so far. As you will recall, Mr. President stressed in a remark that Nigeria was and is indeed among the countries that have displayed an effective, exemplary response to COVID-19, whether in Africa or globally. In particular mentioned that the doomsday that was predicted never happened. And this is because there was a very high leadership, courageous measures taken from the outset, an approach, intervention based on evidence and science. And I would like to take this opportunity to applaud again what Nigeria has done. Nigeria has provided guidance to other countries on how to roll out an effective response to an emerging disease such as COVID-19. Nigeria is also providing an example on how to effectively roll out the COVID-19 vaccination in a complex situation. And from WHO perspective, we look forward to Nigeria sharing its example and experience in how to roll out the COVID-19 vaccine to inform other countries. And currently, we are discussing the possibility of sending a mission here to come and learn how Nigeria has been able to distribute its vaccine so far in a very difficult context. We hope to learn from that and inform other countries on how they could roll out the overall vaccination exercise. But as I said before, it's not about vaccine alone. It's about all of the measures. We need to be aware that while we are battling COVID-19, there are other health challenges that need to be addressed. We need to address the issue of declining routine immunization coverage. We need to address the issue of CV2 outbreak. We need to address many other issues, and we are pleased with the stand taken by the government of Nigeria to focus on the revitalization of primary care, including the vaccination as part of intervention to be rolled out. I also would like to reiterate that WHO does not mandate COVID-19 vaccination as a criteria to enter any country. As we said before, we need to make sure that we vaccinate a large number of the target population to achieve herd immunity. WHO has set a target of 10% of the population vaccinated by end of September and 40% by end of December this year. So we would like to urge the Nigerian government through the NPHCDA and with your collaboration to scale up vaccination, to speed up, to reach that target. And from what we are seeing, it's really feasible to reach those targets. And we would like to commend the commitment of the government of Nigeria to procure additional vaccines to complement efforts that are underway through the COVAX facility. And last but not least, we would like to urge all countries to remember the principle of international health regulation and human rights-based approach, but not imposing restriction to travel to other countries until such time that we'll have everybody vaccinated and hopefully come out of the acute phase of this pandemic.